Good morning. Thanks for joining us for Local 3 News. I'm Brianna McLean. On this Aspirus Medical Monday segment, we're talking about National Men's Health Month. Walter Dowling is a physician assistant at the Aspirus Thorium Clinic, and he joins us via video chat. Walter, what are some medical concerns that are most common in men?
Things like high blood pressure, diabetes, cardiovascular disease are all issues. There's also cancer as an issue. It's one of our, always one of the top causes of death for people. And there are some unique cancers for men. So particularly we worry about prostate cancer with men. As a matter of fact, it's about 13% of men that have prostate cancer sometime in their lifetime. The good news is it is a fairly slow growing cancer, and it is one that we can easily catch with early detection. There also are some other areas like testicular cancer that are unique to men, although those do happen at much lower rates.
What should men be aware of at each stage in life?
As far as adolescents, the things that we kind of worry about is that they tend to engage in a little bit higher risk behaviors. So they tend to, be more likely to have substance use like alcohol or tobacco or other drug use. They also tend to be more sexually active, and so they might have multiple sexual partners, and there are risks for sexually transmitted infections related to that. One of the other things that I think often tends to get forgotten, especially about men, is mental health. And a lot of men do suffer from problems like depression or anxiety, and they're often afraid to seek treatment for those problems. And so that's something that, as a younger adult, I think it's important to, consider. And, if you are having problems, to actually talk to somebody about it and to actually get treatment for those problems, because I think there's a lot of negative connotations with that. But the big thing is trying to be seen on a regular basis so you can prevent problems later in life.
What steps can men take to live a healthy life?
So obviously we want everyone to be living a healthy lifestyle. So things like eating a healthy diet, getting regular exercise, drinking lots of water are all good. Obviously avoiding things like alcohol or tobacco that cause harm is really important. And really the most important thing is to regularly get seen by a primary care provider so that you can get the routine screenings, vaccinations, and other health checks.
How regularly should men go to the doctor?
There are some guidelines out there that say if you're under 50, every 2 to 3 years is fine. However, most insurance companies will cover a yearly visit, and really it's kind of a good way to keep a good relationship with the doctor and make sure that things don't get lost down the road. So I recommend every year.